Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Thursday, July 22nd, 2021. And our top story today, an imaging test may predict patients at risk for COVID heart complications. Well, joining me now to discuss this and a lot more is Dr. Erin Gerlich. She is a cardiology fellow with the Johns Hopkins University School of Medicine. Erin, great to see you. Thanks so much for joining us on the program this morning.
Thanks so much for having me.
And we're going to talk about the heart. Obviously, you're a cardiovascular cardiology fellow at Johns Hopkins. We're going to talk about a test that you and your colleagues developed. Let's talk about COVID a little bit. 170 million people around the globe affected in some way negatively about this disease. But with COVID comes some heart risk. Can you describe what this heart risk is?
Yeah, definitely. So we've seen in patients with COVID-19 higher rates of what we call myocardial injury, or essentially injury to the heart. There's a variety of different types of myocardial injury. The type that we were focusing on most in our study was arrhythmia, specifically abnormal heart rhythms coming from the top chambers of the heart. And we really focused on atrial fibrillation, or Afib as it's commonly called, as well as atrial flutter, which is a similar type of arrhythmia on the heart. And we found that the rates of Afib and A-flutter are higher in COVID-19 patients, and that may indicate a specific type of injury to the heart.
And is there a percentage? So of the 170 million, does everybody walk away with this instance, or is it a small subset or a smaller subset of that population?
No, it tends to be a smaller subset of the population who gets COVID-19. There's differing reports of the incidence of atrial fibrillation and atrial flutter in patients with COVID-19. In our study, this was only patients who were hospitalized, so sick enough to be hospitalized with their COVID-19, and who were ordered for a test called an echocardiogram, or an ultrasound of the heart. So given those caveats, we found a population of about 30% who developed AFib or A-flutter. Now, that doesn't mean everybody who gets COVID-19 develops this. Other reports have indicated about a 4 to 5% incidence of this complication when patients get COVID-19. But it really depends on the population you're looking at. Those who are hospitalized have it more, and those who are critically ill certainly have it more.
Yeah, and Erin, can you talk a little bit about the symptoms of AFib? Is it a racing heart rate? How would I know? Would I know if I had it, and how would I know I had it?
Yeah, so some people don't know at all. Some people have no symptoms. It can be a silent process going on. Other people do get heart palpitations, feel fluttering in their chest, and may feel a racing heartbeat or kind of a pounding heart. Other people get very lightheaded with AFib. They can have incidences where they pass out. You can get chest pain, difficulty breathing, but a good proportion of patients don't feel anything.
Now let's talk about the treatment or the research that you and Dr. Hayes and others have done. How do you detect this? You mentioned in the paper that you co-wrote and authored about the echocardiogram and being able to use that as a tool to really unmask this. How does that work in basic lay terms for people like myself who are not doctors?
Sure, yeah. So atrial fibrillation can be detected on any EKG, and almost every patient who's getting hospitalized with COVID-19 is at least getting an EKG, where you have the stickers placed on your chest and it's an analysis of your heart rhythm. Now, what we did, we were looking at patients who had an echocardiogram or an ultrasound of the heart during their admission for COVID-19. And we wanted to see if there was anything on the echocardiogram that could help predict atrial fibrillation or atrial flutter, or help tell us who is going to be most at risk for developing that complication. So we gathered all of the echocardiograms from patients with COVID-19 that were hospitalized at Johns Hopkins, and we started looking at some of the variables that you can look at on echocardiography. And one of those is called left atrial strain. And that is a measure of basically one of the top chambers of the heart, the left atrium, a measure of its function. And a lot of times left atrial dysfunction or left atrial size abnormalities have been associated with Afib in other populations. So we wanted to see if that was the case here for COVID-19 patients as well. And essentially, we found that left atrial strain is very abnormal in patients with COVID-19, and even more so in patients who go on to develop atrial fibrillation or atrial flutter.
Aaron, this test using the electrocardiogram, the EKG, this is something that I believe most health insurances will cover. So that could be a real benefit in that you've got a process now to evaluate the source of this, and it's covered by most insurance. Is that first of all, am I correct in that? And am I thinking logically there?
So the electrocardiogram is just the leads on the chest that measure the rhythm. That's generally covered by insurance. The echocardiogram, or echo for short, that is often covered as well if there's an appropriate indication. That is a little bit more involved of a test. It requires a sonographer who specializes in heart function to come and ultrasound the chest and get images of the heart. And indications for an echo typically are, chest pain, difficulty breathing, abnormal heart rhythms, any indication that the patient may be having heart failure, and sometimes just swelling in the body can be an indication for an echo.
Well, thanks for that clarification. Clearly, I am not a medical expert, nor am I haven't even watched TV lately, so I would not be able to qualify as an expert there. Aaron, I need to take a very quick break. When we come back, we'll talk more about this test and also potential treatment so that you can protect your heart and a lot more. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings in retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking to Dr. Aaron Gerlich of Johns Hopkins University School of Medicine. Aaron, thanks so much for staying with us this morning.
Thanks for having me.
Absolutely. And this is, look, this is a lot of very important information. And I want to go back to the analysis part of this. And, you mentioned using existing methods and then overlaying this analysis that you and your colleagues wrote about. Tell us more about the research there and the analysis that y'all are doing.
Sure, absolutely. So when the sonographers obtain a heart ultrasound or an echo of a patient, they're getting pictures of all of the chambers of the heart. And one of those chambers is the left atrium. That's one of the top chambers of the heart, that it receives blood from the lungs. It sends it down to the left ventricle, which then pumps the blood out to the rest of the body. And when you look at the left atrium on the echo, there is a software package that you can apply. It's basically an analysis to the left atrium, which measures its function. And we call it left atrial strain. And left atrial strain is not commonly used in clinical practice yet, but it's been shown in a lot of research studies to be predictive of atrial fibrillation in other patient populations. So we wanted to see if this was the case as well for COVID-19 patients who have been shown to have higher rates of AFib or atrial fibrillation and atrial flutter. So we wanted to see if the extra analysis that's applied to the images that are already obtained in a standard echo could help us then determine who's going to be at risk, who do we need to watch more closely in terms of COVID-19 patients.
And as a result, obviously the test very positive, the analysis very positive. Mm-hmm. Erin, in terms of treatment, even if you have, I don't even know if this is the right word, but damage, you have this AFib as a result of COVID-19. Is there a path to healing, to being having a long life if you have it at 50, 60 years old? Can you get better from this?
If you have atrial fibrillation or atrial flutter, these are absolutely conditions that can be treated, managed, and lived with for a long time. Specifically in COVID-19 patients who develop AFib and aflutter, we don't know because we don't have any long-term studies yet, of course. And we're actually doing research ongoing for patients who had COVID-19 heart complications in the hospital, and we're bringing them back for more imaging of their heart to see if this is something that resolves within 6 months or 12 months. So we don't have the data on that just yet, but we're hopeful that just like other patient populations, those who do get heart damage and atrial fibrillation or atrial flutter will recover over time, and it's something that can be treated.
Yeah, and you bring up a really good point, and one that I clearly miss is that we don't know the long-term effects of any of these things because we just went through, we're not completely out of it, but we just went through this pandemic for over 14, 15, 16 months. A lot of parts of the country and the world are still going through it. There will be studies that you and your colleagues and your future colleagues at Hopkins and other medical institutions around the world will be doing to assess this long-term. And there's probably a lot more to come. We can expect a lot more analysis and research by people like yourself.
Absolutely. I imagine people will be studying COVID-19 for decades and decades to come.
Yeah. Erin, if we could just maybe sidestep a little bit and just let's talk about heart health. And we've had a colleague of yours, Dr. Michael Blaha, on previously. But I just want to talk about keeping your heart healthy because you are a cardiology fellow at Hopkins. Can we remind the audience things that we can do? I know obviously diet, exercise, maybe some inner calm. I'm practicing my yoga poses. But what are some things we can do as just ordinary people to reduce our risk for heart disease and heart failure?
Absolutely. So those are, you mentioned the biggest things, a healthy diet, plenty of fruits and vegetables. Activity is really important. We recommend, 30 minutes a day, 5 days a week of moderate intensity activity. That should be everybody's baseline goal. And if you can do more than that, even better. And like you mentioned, stress relief, keeping stress levels low, sleeping close to 8 hours a night. All of those are really important for overall health, including heart health. And
what about mental health? And I just want to acknowledge, people like yourself, caregivers on the front lines during this pandemic, you also had a lot, if you didn't get COVID, you also had a lot of stress in your life. dealing with this, responding to this, trying to figure things out. Mental health, I would think, plays a big role in overall health, including your heart health.
Absolutely, yeah. Any degree of stress over time can increase stress hormones in the body and can increase inflammation in the body, and over time lead to poor heart health. And we have seen associations like that before. So any degree of stress relief that you can do, whether it's mindfulness, meditation, or just getting really into hobbies that take your mind off the stressors in life, can be really helpful.
Yeah, it's amazing to me, and just if I could just offer a point of view, is that how important that mind-body connection is. And if your mind is not in the right place, your body will not be in the right place. And I guess, it took me to almost age 50 to figure that out. But it really is important for anybody, young, mature, older citizens here, to really get that mind right and to get their point of view right so that they can have a long life.
Absolutely. Yeah, we definitely think that's important. And we recognize that nearly everybody had increased stress this past year with COVID-19. Some of the stressors are starting to lessen this year, which is a great thing. And we hope that stress relief continues as this year goes on.
Yeah, and my wife had a lot of stress since we've been quarantined. Aaron, we're going to leave it there. Thank you so much for joining us this morning, and we look forward to having you back on the program again very soon.
Thank you so much for having me.
Thanks, Aaron. Great to see you, and thanks for sharing your perspective. And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the information in retirement, markets, technology, personal finance, so much more, check out today's edition of our daily newsletter, The Morning Pulse. We're back again tomorrow, so until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Are you being audited, and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.